بیننده گرامی، سلامای ما دکتر ناصر اوریا را بپذیرین. ما در شبکه اینترنتی دکتران برای افغانستان در نظر داریم که یک سلسله تازه سوال جواب طبی را آغاز نماییم. در این سلسله سوال طبی مطرح و جواب آن ارائه و مختصرا مورد بحث قرار خواهد گرفت. قرار است این سلسله معلومات مؤثر، مختصر و عملی را در زمینه تشخیص و تداوی امراض شایع در جامعه مورد بحث قرار دهد. امید معلومات این سلسله بتواند دکتران و محصلین جوان در وطن عزیز ما افغانستان در تشخیص و تداوی خواهران و برادران هموطن ما یاری رساند. این سلسله را به لسان انگلیسی آغاز و در آینده قریب به لسانهای دری و پشتو نیز تهیه خواهیم کرد. The question is about the treatment of hypertension. Which of the following is considered a first-line medication in the treatment of hypertension? A. Chlorthalidone, B. Lisinopril, C. Clonidine, D. Losartan, E. Amlodipine. I'll repeat the question one more time, and you try to find the correct answer. Which of the following is considered a first-line medication in the treatment of hypertension? A. Chlorthalidone, B. Lisinopril, C. Clonidine, D. Losartan, E. Amlodipine. The correct answer is A. Chlorthalidone. The antihypertensive and lipid-lowering treatment to prevent heart attack trial, or ALHAT or ALLHAT trial, was a randomized, double-blind, multi-center clinical trial comparing the efficacies of various antihypertensive treatments in decreasing rates of coronary heart disease, or CHD. The antihypertensives used in the trial included amlodipine, a calcium channel blocker, lisinopril, an angiotensin-converting enzyme inhibitor, doxazosin, an alpha blocker, and chlorthalidone, a thiazide diuretic. The study showed similar mortality rates and no improvement in coronary heart disease risk in all treatment groups. Chlorthalidone, a diuretic, was found to be superior in preventing one or more major forms of cardiovascular disease, including stroke and heart failure. These findings resulted in the recommendation that diuretics be the first-line drug of choice and a part of any multi-drug antihypertensive regimen. Although the rates of primary outcomes, including fatal coronary heart disease and non-fatal myocardial infarction, were the same in the chlorthalidone, amlodipine, and lisinopril groups, the study's secondary endpoints, such as heart failure, showed the superiority of diuretics, specifically chlorthalidone. The diuretic users had a small increase in serum glucose levels, but this increase did not affect adverse outcomes. Thiazide-associated diabetes also has been shown to be reversible with good potassium balance, weight control, and increased physical activity. Thiazide-based treatments for hypertension are less expensive, and the additional laboratory monitoring for hypokalemia or hyperglycemia is probably no more than that required during ACE inhibitor administration. Although ALHAT or ALLHAT trial has legitimate limitations, its conclusions appear valid. The newer antihypertensive agents tested are not superior to diuretics in the prevention of cardiovascular disease. These newer drugs are more expensive and appear to be less effective in preventing heart failure. Diuretics appear to be the preferred first-step drug and the important part of any multi-drug regimen for the treatment and management of hypertension. In conclusion, based on the ALLHAT trial or ALLHAT trial, diuretics should be the first-line drug of choice when treating hypertension and a part of any multi-drug antihypertensive regimen. Thank you.